Hey y'all, yesterday I had the pleasure of recording this conversation with Dr. Marissa Aron, a pediatric physical therapist and someone with whom I've worked with and referred patients back and forth with for a number of years. We got into some topics that are interesting, sharing our own experiences, observations, and ideas. And I have no doubt that some of these ideas may raise some eyebrows, ruffle some feathers, and even offend. So please, listen with a curious mind. Don't think that if we say something that you chose to do otherwise, that in any way it's a personal attack on you or your parenting. It's just something that we've been able to observe and recognize and hopefully shed some light and create some interest in learning more. As always, none of what we say are considered clinical recommendations for you or your family, so make sure to discuss anything that's interesting with your trusted provider. If that's one of us or both of us, even better. I hope you enjoy the conversation and please share your own thoughts in the comment section. Hey, everybody. My name is Dr. Ian Shtulman. I'm a pediatric and prenatal chiropractor in South Florida. And I get to be joined by my friend, Dr. Marissa Aron from Mommy and Me PT. And we've had the pleasure of working together for a few years now. And we have referred patients back and forth. And I think we could probably both say that our patients seem to have a really, I would say, even better response when they're being provided both from a chiropractic and physical therapy perspective, which I think is great. So I figured we would get on here and have a conversation and talk about some ideas and see what comes of it. So
Yeah,
Doc,
100%.
thanks
I'm
for
so
joining
excited to
me.
chat. Thank you. Thank you. I'm so excited to chat with you.
Tell me, just for those of you, myself included, who don't know a whole lot about your history beyond how amazing of a physical therapist you are, tell me a little bit more.
Yeah, so I started out as just a pediatric physical therapist. I do pelvic and prenatal as well now, but pediatric was my first love. And I worked at an outpatient clinic for a while, like your typical pediatric clinic, and was just really frustrated with the state of that, the way that that operated. I always felt like we weren't able to give care the way that I felt passionate about caring for my clients. I ended up moving to Joe DiMaggio Children's Hospital after that and was so lucky to have that experience. I worked in the NICU there. I worked on the acute floors there, so babies who were, really acutely sick. And I also worked in the rehab there, so kiddos who were staying there for a long period of time. So I've got a really wide range of experience there. And then I decided to start Mom and Me, and really it's been all about providing families with the education, the support that I think all families deserve. And a lot of it is just really easy stuff that everyone should know, but it's just not really being told to families. A lot of kind of things from a preventative lens with developmental milestones. And so that's what I became passionate about. And then, of course, the more you spend time with babies, the more you hang out with moms. And that's really how my prenatal uh, fire started to get lit. And so now I love working with pregnant and postpartum women as well. And it's really funny because it's a similar thing, like so many things that are so easily treatable that moms just don't really even know they can do anything about.
Yeah, I see the same thing is that there's a lot that people have just come to accept as normal,
Mhm.
which they're not. They just happen to be common. And when you're in a situation, when your primary provider, whether it's a pediatrician or an OBGYN or a midwife, kind of dismiss it as, oh, this is just X, Y, or Z, um, it kind of creates this experience where you expect to either be uncomfortable or you expect your child to be miserable for a while, and neither of them are normal. They just happen to be really common, and there's not an obvious medical treatment that leads them to say, okay, yeah, we could do something about this. But I think that's
100%.
where both of us seem to have had success in those people that haven't been able to get that clear-cut answer from their medical providers.
100%. I'm curious if you get the same thing because I feel like, 70, 80% of my clients who call me for the first time always say something like, I'm not sure if this is just normal colic or normal head turn preference or normal XYZ. And the answer is, no, it's not normal, but it's totally something we can do something about. And it's so important to give them that support.
There's that distinction between what's normal versus what's common.
Yeah, exactly.
It's common to have a child with colic and reflux and torticollis and developmental delay. It's not normal developmental, and or a normal aspect of normal development. And I think the, not to jump immediately on a landmine, but the
Come on,
gaslighting
that's what
of
we do.
parents of, essentially dismissing their concerns, writing them off, uh, you know, oh, you just have a fussy baby. Oh, you just, they'll grow out. Like that sort of conversation, I think, does such a disservice to parenting. And I know many, like for instance, like I know many parents who probably would have had more than, however many children they have now, if it was just a little bit easier and if they had a little bit more support during
Mhm.
those first few months and first few years.
Absolutely. It's one of my biggest, it almost feels like heartbreak. Like I hate to hear, parents who also call and say, um, I'm not, I know I shouldn't really be worried, but I am. I know that this is probably fine, but I just really want that extra support. And I hate that they always feel so bad about wanting that. So like wrong for wanting that because that's what unfortunately it seems like the medical system is doing these days is like making you seem crazy for noticing these things and having concerns and questions about them.
How dare you want your child to develop appropriately? Like how
Wild.
selfish could you be?
It's so wild. Yeah.
So, it's interesting because chiropractic and physical therapy are viewed by many as like competitors, right?
Yeah.
And in fact, in many people come to me and they're like, "Oh, I also see a physical therapist." I'm sure you probably experience the same.
Yes.
Um, I want to start by just asking like, what do you like? What I'll give my chiropractic explanation. What's physical therapy all about, just particularly in like a pediatric and perinatal context?
Hmm. Okay. That's a very big question.
Yeah.
I view my role as supporting, primarily work with 0 to 2. So I'm just going to use the word babies, supporting babies in that developmental milestone journey. And to me, that includes addressing everything from tension, strength, coordination, balance, um, motor control, their daily habits and routines, facilitating the places that they spend their most time, um, the entire lifestyle that's shaping that developmental milestone journey. So I really feel like I not only, physically help a baby roll, but let's talk about all of the different factors that are playing into that. Um, that's probably the most simplistic way I can put it.
So like how they move through space and how that influences their development and, bodily function and overall, health and well-being.
Right, because as we know, how their body develops affects not only the way that they're able to physically move, like roll, sit, crawl, walk, run, jump, but how their body develops in terms of their posture, their strength, their tension or lack thereof, their control, their balance. It also affects the way that they're able to have a bowel movement and use the bathroom. It affects the way that their digestion functions. It affects their social development, how well they're able to participate in social activities as they're older, cognitive and language development. A baby's cognitive and language development is limited by how much they can interact with the world. So that's why we see such a huge leap in cognitive, language, social development once they start crawling, because now they have access to so much more of the world. So it's such a huge and close direct relationship.
Yeah, absolutely. Chiropractic looks at it from a similar perspective, but looking at different parts of the body. So
Mm.
I've always interpreted, physical therapy being concerned about gross motor, the way the whole body is moving and developing in coordination with one region. Chiropractic at its root is concerned about the relationship between the spine and the nervous system.
Mhm.
And if the nervous system controls and coordinates everything in the body, whether it's our movement, our digestion, our emotions, our immune system, our how we adapt to the world, then if that nervous system is impaired or compromised or under any undue strain and stress from unresolved trauma that's restricting the spinal motion, then we're going to have a child who's going to have a harder time experiencing and adapting to the world around them.
Yeah.
And so, uh, you know, we see that chiropractic is, and I think this is where chiropractic and PT probably differ the most, is that at its core, chiropractic is less concerned with treating individual like symptoms or conditions or like movement patterns and more focused on allowing that nervous system to regulate and coordinate things without that interference. And at least the way that I've approached it in my practice, and hopefully this isn't news to you, is that I often tell people that uh, from a chiropractic perspective, we can allow the body to work better. And then from a physical therapy perspective, they can work with your child to help develop those skills that they may not have been able to develop because of that restriction and interference in that neurospinal system. Is that
Yeah.
fair? Did I totally
I
offend you?
actually, no, no, no. I actually say that sometimes to clients as well. Like, I think chiropractic, I do body work, I do soft tissue work, and all of those things. But I think chiropractic is a really helpful addition in the way I usually say it is opening up access
Mm,
to
yep.
certain, let's just say movements for the sake of it right now. And then I think physical therapy sometimes then is really great at stepping in and now helping to practice using what you now have access to.
100. I think I love that context of access. It's because we see these kids who have this innate potential to develop and
Mhm.
heal and adapt to the world around them. But there's something that's interfering or distorting or blocking and making things harder for them to achieve.
Yeah.
And so the whole idea behind chiropractic is how can we allow that child, instead of trying to treat what's wrong, how can we help that child tap into what's right and allow them to get access
Mm,
to the higher stages of development in their brain, in their body, and ultimately how is that going to influence their overall quality of life?
yeah.
And then typically I usually tell people if your child hasn't been learning how to move and do this, they need somebody, often to support them in figuring that out and being able to develop those skills that are going to serve them for the rest of their life.
And that's really what I love about you and our, professional relationship is I do feel like sometimes PTs feel like they can do both by themselves. And I do feel like sometimes chiros feel like they do both by themselves. And I
Yeah.
think what I love is that we are open at least to the idea that babies do better when they have both.
Yeah. It's that whole old adage about being the master or a jack of all trades versus the master of none.
Yeah,
I've always loved the idea of just being an expert in what I do in chiropractic,
totally.
and I know that I don't have the same training in the physical therapy world, and why would I try to do it all for somebody instead of just developing a relationship with an amazing physical therapist who is passionate about that part of the work?
Yeah.
So that's
Yeah,
great. I
I
mean, listen, that's
appreciate
great to
that.
hear because,
Yeah.
I've wondered for a while. I was like, oh, you know what? I get so many referrals from Dr. Marissa. I wonder what it is that she says. And clearly, your patients love and trust you because they're willing to come, see the chiropractor, but based on your recommendations. But I think that's a really, really insightful in terms of the way you view that.
Thank you. It's really
So.
how I wish the medical world, bringing us back to that because I think this is helpful for families to also hear and see it this way. Sometimes is pediatricians, we shouldn't expect for them to know all of these things,
No.
right? Okay, am I getting you into another rabbit hole? Pediatricians, I think a lot of families expect for them to know all things baby related or child related. And so we go to them with questions about reflux, and we go to with them with questions about our movement milestones and our head tilts and all of our colic and all of these things. And unfortunately, what I find is that most pediatricians are not as great at doing exactly what we're doing right now, which is knowing what you're a specialist in and then just recommending that you go see the specialist in that thing if that's not your specialty. That referring out, it doesn't take away from my skill or my ego at all. It only adds to my relationship with my patients because they are so grateful that I pointed them in the direction of the person who can help with them with this. So I wish that for families to see it that way as well.
You know, I describe it as your pediatrician is an expert in the diagnosis and treatment of disease.
Yes.
Um, they're not experts in the promotion, maintenance, or restoration of health.
Mm-hmm.
And very often I find that when parents present problems or concerns to their pediatricians, if it doesn't cross the threshold into pathology, if it doesn't reach the point where there's like a medical specialist to refer to,
Yes,
it's you're kind of just dismissed as, oh, they'll grow out of it. Oh,
absolutely.
you know so it's so important to recognize that your pediatrician is an incredibly valuable resource, and I refer back and forth to pediatricians all the time,
Of course.
but they're experts in one part of a child's development, and they don't get the same training in breastfeeding, they don't get the same training in movement and development, and so there are things that they just don't recognize as early problems that someone like you and I, as a physical therapist or a chiropractor, might recognize and say, oh, that can be a big problem later on if we don't address it now.
Absolutely. Yeah.
So speaking of which, like, if you were going to talk to a group of parents and ask what are some of the biggest misconceptions and maybe just the one like big misconception
Hmm.
that parents and even other professionals have about pediatric development that you and I might have a different perspective on.
On pediatric development, it really all comes down to the sentence, they'll grow out of it. That's really the first thing that comes to mind. Um, I can look at a 10-year-old child from behind who's just standing still and see that head turn preference that he had when he was 3 months old if it was never addressed. And I know they can't see it, and I know that most people can't see it, but it is in there and it is affecting them. And it doesn't go away unless we address it.
It's so funny because in preparation of some of these questions, I thought to myself, I was like, oh, what would be the biggest misconception? And immediately my first thing that came to mind was kids don't outgrow things. Like they don't grow out of developmental delays, right?
Yeah.
They learn to compensate. They
Yes.
find new ways, but typically the underlying problem just manifests in a different way later on in life. The
Yeah.
kids in my practice that had colic and breastfeeding issues will often have speech delay and chronic ear infections and then learning issues later in life. And it's not a one-to-one, so it's not like a causative type of thing that you could really document well in a study. But I typically find that these kids don't outgrow things. They just manifest differently at different stages of life. And so this idea of seeing somebody and evaluating your child for development and identifying and correcting some of these issues early on, I think sets such a better foundation for them to build everything else from that point forward.
100%.
Yeah. All right. So one another question that I had.
Totally.
And I have a feeling this is just gonna be like, oh my God, we agree.
I love that we're on the same page about everything.
If you had to think about some of the biggest factors, and I'm not going to hold you to just one, but some of the biggest factors you see that interfere with normal childhood development,
Ooh.
what would those be?
Okay. Um, I gotta say containers first.
Yeah.
I love your facial expressions.
Yeah. I mean, listen, we've talked about this, like container children is yeah. So I have a little line that I've been using recently, but I want to hear your thoughts first.
Okay, that has to be my biggest one. I have probably a couple others, but that has to be my biggest one because anything you put your baby in is going to restrict their movement. It's going to restrict their ability to explore, aka learn, aka develop. It is going to further cement any sort of tension or restrictions that they already have. Um, it's everything wrong with society these days, if I could just make a really big blanket statement.
I'm going to make
Um,
a bigger blanket statement in a
Tell
second.
me.
So
Okay, okay. That's really my biggest one. Your baby does not need any of those things, literally none of them. You can, when you go to the bathroom, you can put your baby on the floor mat. And if that floor mat needs to be put in the washer before you feel safe doing that, do that. But you can put them on the floor. If you, any of the things, if your baby needs to be hanging out with you in the kitchen so you can make dinner, they can be on the floor in the kitchen. Um, we don't need any of the stuff that we're being sold now, period. And it only harms your child.
yeah, my line for that is um parenting. And listen, this might be the comment by itself that gets me canceled, but um parenting is not supposed to be convenient.
Mm. Ooh,
All of these devices, these containers, the Duna stroller that goes from car seat to stroller to car seat to the swings and the snoo and all of these products that are designed to make life easier for parents do so by sacrificing the optimal development of the child. And it may not be super obvious at first. I know there's going to be like parents who hear that and are like, well, my child did this and they totally turned out fine. And I always have the question of, yes, and could they be better? Right?
yeah.
Is there something in their development, in their coordination, in their head control, in how that movement influences brain development that would allow them to be an even better, more fulfilled and more fully expressed version of themselves?
I
And I think
100%
that
agree.
is just, this idea that we need things to make it easier for us. Parenting is a huge sacrifice. It's hard. Children are not easy. I have a 9 and 11-year-old who are not and still are not the easiest children. Um, I hope they don't barge through the door right now and come yell at me. But the reality is, as parents, we make sacrifices for our kids because we know that we're serving them in their future. Um, my wife and I, we left the car seat in the car. In fact, if I could go back, I would never get one of the bucket car seats that comes in and out. I would
Mhm.
only buy the convertible, which would last you through like 3 to 4 years.
Yeah.
Because we held our children, we did baby wearing religiously. Our kids contact napped with us. Um, they got that physical connection, and it wasn't always easy or convenient, but I really think it served them in their development, in their emotional maturity, in their immune system, in their, even cognitive development based on their movement. Those are things that are too often dismissed in an effort to try to make things just a little bit easier for parenting.
100%. I really like what you said about we don't always know the way it's going to show up. I have adult braces right now because my tongue never really functioned properly, and now my teeth are really, bearing the brunt of it. Could that have been addressed when I was a baby? Absolutely, but
Yes.
it's showing up 30 years later. Now, can we prevent absolutely everything that's going to happen in our children's life? Of course not. But those chronic ankle sprains that happen in those middle school and high school years, where's that coming from? Even to go a step further, scoliosis. Doctors call that idiopathic scoliosis, saying we don't know why it's happening. Well, I bet you and I believe that we kind of do know. And so it's just all of these things that, again, in our society and in our world are just viewed as normal. And again, we're not going to prevent all of it. Accidents happen, things happen. Braces are not the end of the world. And also, could we have noticed some things in the first 6 months of life and really easily addressed them and supported our child through that? Yes.
Yeah, completely agree. I think it's funny, out of all of the biggest factors that we think about, the first one that both of us mentioned were containers. Um, you know, any other big one that you think is part of it? Because I have one other big one that I think is should be mentioned.
The one I'm gonna say is gonna get me in trouble.
It's gonna be what? Sorry.
It's gonna get me in trouble.
Do it.
The sleeping on their backs, I think, has really. Ugh.
Girl, you and I are just like mind meld right now.
I know I can't say it. I like feel like I legally can't say that. And also, it totally ruined development.
It's so interesting because I have this conversation with parents all the time, and I try to create context because all parents hear is if your baby sleeps on their back or on their belly, they're going to die.
Yeah,
And there were so many other factors that went into the SIDS epidemic. We now know that there are genetic components. We know that things like secondhand smoke in the house, which was way
Mhm.
more common, circulating fans, the bumpers on the cribs and the blankets, and all those things go into it. But the only one that's really ever mentioned is don't have your baby sleep on their belly.
Right.
And in some of our coursework, so I teach for the International Chiropractic Pediatric Association, and there's a fantastic neurodevelopmental instructor named Dr. Michael Hall, and he talks about the importance of being on your belly, not just in tummy time, but when we think about the curve in the neck, when we think about the neck muscles developing and how that feeds into the brain and the
Yeah.
control and movement that affects in kids, we're just spending too much time on our backs. And then it's even worse when you combine both of these and you put kids on their back in restrictive devices and
Right.
containers that lead to the epidemic of the plagiocephaly and helmets and torticollis that are often a result of my baby's really calm. They're so peaceful. They sleep all the time in their containers. Oh, we wrap them and we make sure that they're all wrapped up and on their back, and they sleep through the night. Like those are things that make things easier, and I totally get it. But they're not always things that make things better.
100%. I have a
Um,
question for you while we're talking about these two things, because I want to bring reflux into the chat. And
Bring it into the chat.
I feel like
Reflux has
reflux,
entered the chat.
I feel like reflux is so unbelievably common right now. And
I
I'm
think the word you
curious,
meant was overdiagnosed, but yes, I would agree.
sure, sure, sure. I'm curious if you think, if you can point to anything, that's causing all of that reflux and GI discomfort and dysfunction in our babies these days.
So there's a couple of things. First, I always, because parents come to me all the time with the question um, oh, my baby has reflux. And my first thought is, okay, what do you mean by that? Like, and that's the question I ask is, tell me what your day looks like.
Mm-hmm.
Oh, my baby eats and then they spit up. Okay. Is your baby struggling to gain weight? No, they're gaining fine. Are they going to the bathroom and getting regular, dirty and wet diapers? Yes. Are they aspirating on the spit up and choking or no? Okay, then this is a laundry issue. It's not a health issue,
Mm-hmm.
right? Many times you hear this conversation of, oh, they're a happy spitter. I said, no, that's normal development of the digestive tract because all babies come out with a underdeveloped esophageal sphincter, right? Like that the connection between the esophagus and the stomach is just not well developed because babies have these really small stomachs and they need to eat, which is why they need to eat more regularly. But what happens if they overeat? It has to go somewhere, so it comes up and they spit up. So if it's that sort of situation, I'll usually tell parents this is it's a laundry issue. It's not a health issue. As their digestive system develops, it'll be less and less of a concern. They're not going to spit up after every meal for the rest of their life.
Yeah.
But when you see kids who are struggling, I often think of this in like kind of two contexts. One is there something in the food, in the diet, in mom's breast milk, in the formula that is just not agreeing with that child, and they're having this exaggerated reaction, causing them to get rid of it and having burning or discomfort as a result. Then the other conversation is how do unresolved birth trauma potentially disrupt digestion. And this is where, from a chiropractic perspective, I think is where we really, really can serve young children. Because when we think about birth, even whether it's a beautiful, natural, vaginal, unmedicated at home, or it's a scheduled C-section, it doesn't matter. Birth is inherently traumatic. Um, could be more so in certain situations than others, but the forces of contractions pushing baby's head deeper and deeper with every contraction for potentially days or even weeks causes a tremendous amount of compression in the upper part of the neck. And then when baby's head is out, whether it's through a surgical or a vaginal birth, most midwives and OBs now grab baby's head and pull. So you go from this compression to this traction. Now, rule number one about holding a baby is what? Protect the
Or
head.
the head.
Yeah, because they've got these giant bowling balls of a head sitting on a toothpick of a spine. The joints are underdeveloped. The muscles are weak. The ligaments are hypermobile. And so they've just got this like just constant force even after birth. And why is this so important? Is because right at the base of the skull are three nerves that exit what's called the jugular foramen. I'm not going to ask you about, a board question that you may not have taken in a while, but those three cranial nerves are the glossopharyngeal nerve, sucking, swallowing, tongue and lip function. This is why so many babies can have breastfeeding issues. Um, the spinal accessory nerve, muscle tone, specifically the SCM, right? Contributing to things like torticollis or preference and rotation.
Mhm.
And then the vagus nerve, which is about 75% of rest and digest function in a child. So, what happens when a baby is traumatized from birth or from an overeager grandparent picking up their child, not supporting the head properly? We end up seeing that if the top bone is, I don't want to use the term damage because I think it exaggerates it a little bit. But if there's any sort of restriction or abnormal motion in that, you know, occipital, cervico, cranial type of junction, then it creates tension and interference to these nerves. And as a result, we see that particularly in those three nerves, I think are really relevant because those are some of the most common issues that kids see early in life, right? We see that baby who doesn't latch, or they latch too painfully, or they won't open their mouth wide enough, or they can't generate that efficient sucking response. We see the babies who have a restriction in the way that they're looking, or they're tight, they develop torticollis that leads to the flat spot, that then leads to the plagiocephaly and the helmets. And then if there's irritation of the vagus nerve, we have a child who is now stuck in this chronic fight or flight response. And they're irritable and they're fussy and they won't settle and they won't sleep. But it also means they have less efficient digestion.
Mhm.
And it's not so much, again, the spit up, but it's this incoordination between the demands that they're facing in this new life and what they're actually able to meet. And
Mm.
as long as this gap is here, as long as kids can't match the demands they're facing, they're going to be uncomfortable and they're going to be affected in some way in their quality of life. So, what does chiropractic look at? We look at the relationship between the motion of the spine, particularly in the upper part of the neck, and how that influences the nervous system. If we can help that work even a little bit better, it's going to allow kids to have greater access to their movement, to their regulatory state. And that's ultimately how we're able to help kids with those sorts of issues.
Love it. Yeah,
Yeah. And I mean,
I
I
always
think,
tell parents spitting up is the least of my worries. If that's what we're
yes.
talking about, great. Yeah, when I think of reflux, they're usually the kiddos who are just so stiff, so much extension,
Yep.
so much irritability, not gaining weight, not tolerating independent floor time. That's the constellation that I really am just concerned about and seeing so much of.
Well, it's interesting because I often draw like a little diagram for my patients. And I'll explain to them like the connection and relationship between chiropractic and physical therapy is I'll say that we're all exposed to some sort of stress, physical, chemical, emotional stress, whether it's in utero, during birth, early infancy, it doesn't matter. We're all exposed to this stress. And the nervous system, in an effort to adapt to those stresses and protect the system as a whole, will often lead to tight and overactive and defensive guarded muscle tone.
Mhm.
And if that muscle tone is distorted for a long time, it restricts the bones, which lead to adhesions within the ligaments and the joint capsules. And now that restricted motion further irritates the nerves, which then further tighten the muscles. And we're stuck in this loop.
Yeah.
And the medical treatment is muscle relaxers, pain reliever, right? Like let's give some sort of like medication as a way of disrupting that nervous system or altering that nervous system.
Mhm.
But if you do that, eventually it wears off and the problem just continues and typically gets worse. Well, how does, PT and chiropractic? Well, chiropractic is focused on the relationship between the motion of the spine and how it re-aggravates the nervous system. Physical therapy is about how do we rehab and retrain and restore function and movement in the soft tissue and the body as a whole, so that together I think we're able to break that cycle. And I usually
100%.
explain to the parents in my practice that you know, we each, both, your practice and mine, we have people who come see us and they get everything that they think they need. And in my experience, the people who are doing both tend to get even better responses and faster responses because they're breaking that cycle at multiple points.
I totally agree. I think it's that same kind of access and then using the new access type of relationship with that because I feel like those kiddos who are tense, who are really extended and up on their toes or, arching themselves backwards, they have no access to even finding their abs. They have no access to finding their flexion, their ability to push into the ground, any of those things. And so I have a toolbox that helps with that access, but I think that you're also such a helpful and important part of that process of finding that access. And then they benefit from now training to use those newfound muscles, that newfound coordination, that newfound movement pattern, movement control, all of that stuff is a whole new direction of movement that their brain hardly even knows exists.
Yeah, 100%. Um, I have I want to respect your time because I feel like we could probably do this for the next few
I know,
hours.
right?
Um, I have one question that I really wanted to ask you, and you kind of alluded to it earlier when you mentioned the importance of crawling in development.
Mm,
In 2022, the CDC changed the milestones, right? I'm sure you are very well aware,
yeah, they
where
did.
all of a sudden crawling, which has been important part of development for all of human existence, suddenly became a milestone that was irrelevant, and they eliminated it from like the milestone guidelines. I certainly have my thoughts about this. I'd love to hear yours.
Thanks for getting me heated on Friday afternoon. Yeah, that was a really unfortunate development. So the reason why they claim to have done that or made that change is because they say that those standards were originally based on this is what 50% of kids are doing at this age. Here you go. And they decided to change that threshold to 75%.
Hmm.
So now this is what 75% of kiddos are doing at this age. Here you go. Nobody, for some reason, asked the question, why are less kids crawling? What's happening with crawling? And that is the piece that really I have to just regulate and breathe. Um, that's the piece that really blows my mind. And it goes back to everything that we've been talking about that answers, I think, those questions of why kids are not crawling as much anymore. That doesn't mean crawling is all of a sudden no longer important. Crawling is, I think, the most important milestone and much more difficult than walking. Um, it really just really boggles my mind, and it was a huge disservice to families and children.
Yeah, I'm gonna take, and I don't want to say necessarily a conspiratorial perspective on it, but
Okay.
let's be honest. If the pendulum in terms of like pediatric, like early intervention has swung so far to the point that I think we tend to pathologize everything now.
Mm,
And what ends up happening is if you have children that are delayed in development, they're not hitting a certain milestone, then by definition, it warrants treatment.
mhm.
Well, guess what? That requires therapists, it requires money, it requires time. And I think we have a system that doesn't have enough specialized care supporters, like yourself. I don't think we have a system that has the insurance reimbursement that makes it possible for most families to access this care. And as a result, we had a system that was, by definition, leaving children needing treatment untreated. And it's far easier to just say, well, if this many kids are no longer crawling, then it must not really be necessary. Then it would be to say, hey, it's necessary to increase funding and support to get these kids the support they need. And so like I know you're just like nodding your head, right? Like but
It's hard. I really try my best not to believe that that could be true, but you're probably right,
I
unfortunately.
mean, here's the thing is that we absolutely need to ask that question. Why are kids not crawling and why are they delayed in
Yes.
these developed? Why are they missing? And I think honestly, our conversation earlier about containers and not just putting your kid down and I think that's a huge part of it. I've always told people that your child grows and develops new skills out of frustration and wanting. It's you don't want to just leave a kid and let them cry forever, but you want them to get frustrated enough to a point where they're motivated to develop new skills.
Right.
Uh, but nobody asked the question, well, why are they? not developing these skills in the first place. And I think the reality is we have a system that is it's a for-profit system, and it's not necessarily in the focus of child's development and health as much as they are, um, how do we keep the system afloat? So, not
That's a
to get into the whole
sad
politics
one.
of healthcare funding
Yeah.
or anything, but I think we're in a situation where the system is willing to let kids struggle if they don't have a way of fixing it.
Yeah.
So, um,
That's a bummer.
yeah, I wish I had like a positive tone that I could end it on. I just think
Ugh,
it's one of those things that you and I would both agree or both agree that crawling is an important milestone in brain development, in body coordination, and there's a certain like progression from moving your arms and limbs to rolling over, lifting your head, to being able to sit, to
right.
crawl, to stand and cruise, to walk. Like these are things that need to happen in a certain developmental pattern to allow the body to optimally develop.
Here's this positive spin on that. We can't necessarily change the whole politics of healthcare, you and I. But the positive thing is we do understand that exact process that you kind of just listed out. Child development is actually a very well understood process. And there might be, a 3 month window for certain things, but other than that, it's pretty standardized. It's really well understood. It's really predictable, and it happens in a predictable order and at a predictable time, and all of these things that we really understand. And for some reason, it's kind of turned into like babies will do things when they're ready. And like that whole idea of like, no, actually, we know how this goes has been thrown out the window for some reason. But the positive spin is we do know how to influence all of these steps. They are very easily influenced and supported when you have the right provider who's showing you, hey, this is the next step. Now this is the next step. Now this is the next step. There's an order to these things. For your kiddo who isn't crawling, we can't always just put them on their hands and knees. Sometimes we have to go back a couple steps and meet them where they're at and build from there. But again, the positive is there are people like you and I out here who really understand what that looks like, what to do, and who are so passionate about helping families do that. Unfortunately, the system as a whole, maybe doesn't look like that, but there are people out there. And so as long as families know that and are willing to find the right tribe and the right support, it's actually a very, very doable thing.
Completely agree. You can't just plaster over the cracks in your ceiling without addressing the foundation of the house.
Yeah.
So, I one last thing, and then we'll finish up. If you
Okay.
had one message for parents, one lasting thing to take away from this, what would it be?
I think it would be don't view getting support from someone like you or me, don't view those things as um, meaning that your child has something wrong with them, meaning that you did something wrong, meaning that anything is wrong. I would love for families to view people like you and I as an automatic part of their team, just like their pediatrician, and to view it as bettering yourself, as a parent in preparing and educating yourself on what this now means and what this looks like now to be a parent. You don't go into a new job, as anything without some education and preparation other than parenthood for some reason. And so, I think viewing providers like us as a part of the team, a great way to educate and support yourself and your child, and not as something wrong, um, really, I think is the key.
Um, going back to my comment earlier about like the philosophical distinction in chiropractic is how can we help more of what's right in your child be fully expressed than thinking that we're trying to suppress or treat something wrong with them, right?
Yeah.
Your child is born with every single thing that they need to be able to survive and thrive. And they may not be able to access it, and maybe they skipped a step and they're having a hard time integrating those patterns and developing in their movement. And there are tools and resources out there. And that's why I think both of, what we do should be a routine aspect of pediatric development. And it's one of the reasons why I appreciate you as a provider, appreciate you as what I consider a friend. And, thank you so much for joining me. Look at that. Chiropractor and physical therapist agreeing on pretty much everything. I think next up is world peace, Marissa. I think that is what's coming up next.
That's what this means. It's the only answer.
Well, thank you so much. And thank you for anybody who
Thank
decided to
you.
watch, especially to this point, because I'm sure one of us, if not both of us, has offended either you or a core belief or something you've been
100%.
told by your trusted professional. But, thanks so much.
Thank you. I appreciate you.